So, welcome ladies and gentlemen. The German Association for Sports Medicine and Prevention, DGSP, will not only host the 49th German Sports Medicine Congress starting October 29th through 31st in the year 2020, but also a whole sports medicine and health summit. I'm here together with Professor Jürgen Steinacker, who will be the Congress President. Professor Steinacker, what innovations will DGSP come up with?
We will talk about the whole problems of the 21st century. We're facing the problem of inactivity. We're facing the problem of unhealthy lifestyle, obesity. And these have to be these are a challenge for all of our life, for our societies, and therefore we want to address it not only in the focus of sports medicine as a discipline, as a very important discipline, but we want to invite other societies to our summit. And the summit means we want to join with other people our experience, we want to learn from them and then create more science and more knowledge.
The city of Hamburg will be your venue for the Congress, for the Sports Medicine and Health Summit. So why did you choose Hamburg to host this event?
First, I think Hamburg is a beautiful city. Yes. It's an active city. It's a global city. It's the port of Germany. And it's worth to come to Germany and visit Hamburg. The second issue is that Hamburg, as a very big city, the second largest city in Germany, is actively facing the challenges. They have released a plan for a global active city and were rewarded with the title last year. And this means this city is facing the challenges. This city is actively handling the change in society with active transport, with human changes, human-oriented changes in the city itself, buildings and so on, greening, and also with promoting a lot of physical activity inside the society, a lot of sports clubs, active society, and this is Hamburg.
You mentioned Hamburg's role as a global active city earlier. The city will avail of the opportunity of presenting itself there on the Sports Medicine and Health Congress, but there will be more. Exercise is medicine, for example, will be there too.
Yeah, exercise is medicine is a global activity as well. It also invites people to come on this bandwagon, to come into the boat. We are in the harbor, and to come in the boat and to share our goals. The goals are really to make the society more healthy, more active, and to have a better lifestyle and makes them a little bit also more happy. And this can be only achieved in inviting people. And particularly medicine has a critical role. We learn that primary physicians have a big role to advise their patients, their families, to change something in their habits. And therefore, Exercise Medicine is a program to enable people to do this. And this is something which is not only privately owned by sports medicine, it is a challenge for all of us.
I really like your metaphor about the boat. So let's talk about the boat. For sure, the target group will consist sports physicians, of course, but who else is supposed to go on the ride? Who else is supposed to join the boat?
Yeah, we want to have a lot of societies there. Exercise Medicine was mentioned. We want to have the German cardiologists, pulmonologists. We want to have diabetes. We want physiotherapy, sports therapy. All these people who have the same interest. We want to also invite European societies, European Federation of Sports Medicine Associations. We want to have also EFSMA, FIMS, the International Society as well. We have ACSM invited. So we want to have also a global view in Hamburg, to have the best scientists there, interesting lectures, We want to have really exciting scientists here. We want to have exciting speeches. We want to have physicians who know how to deal with the problems. We want to have hands-on seminars, hands-on courses for the basic skills, but we also want to have the technology issues here presented. So it's an open market. If we want to have a lot of people there, we want to be open to ideas, and we want also your ideas in Hamburg.
So let's say the boat is ready for boarding. We're expecting the Sports Medicine and Health Summit 2020. We're looking forward to see you there. We cordially invite you to this summit. And thanks very much, Professor Steinacker, for answering my questions. And we're looking forward to the summit.
Yes, wonderful.